Hello, my name is Dr. Symko. Another pattern that can produce thyroid illness symptoms is another hypothalamus paraventricular defect related to low dopamine levels. Now, dopamine is a neurotransmitter like serotonin and can also be affected by certain situations, certain things that can cause it to be deficient, which then can cause the hypothalamus not to function very well, which would actually cause the thyroid gland not to produce the amount of thyroid hormone needed to cause you to function normally. It's really that simple. Now, again, blood tests can actually determine the types of problems that are associated with these other illnesses that can actually mimic thyroid problems. The only thing is neurotransmitters cannot be tested through blood work. They have to be looked at through questionnaires and history. And dopamine is one of the neurotransmitters that needs to be looked at through questionnaires and history. Dopamine deficiencies, usually individuals with dopamine deficiencies, have a feeling of worthlessness. There's no meaning to life for them. They have a lot of anger. They want to isolate themselves. Now, these can be related to a lot of other things that are going on, not just dopamine deficiencies. But again, it's inferred, it's hints. It's very important to gather a thorough history of what is going on with you or whoever to determine if indeed dopamine is a problem. Now, the other issues with dopamine is if you are a heavy caffeine user, nicotine user, or even a recreational drug user like marijuana, can actually cause dopamine to become severely depleted. Initially, these types of drugs can cause an increase in dopamine. You feel good. But then what happens is that the regulator or the regulation of dopamine output is squashed, is actually hindered because it becomes basically exhausted because you've exhausted it by using these drugs to influence the output of dopamine to the point where your body can't really do it anymore and you come into a dopamine deficiency. The other thing is dysglycemia. Now, dysglycemia can be checked through blood work and lab work, and this can give us hints as to why maybe dopamine is a problem or deficient. Dysglycemia is very important in terms of neurotransmitter synthesis, producing neurotransmitters. And dysglycemia means sugar levels that are out of balance, basically, whether it's too high or too low. Eating too much sugar can actually cause your insulin levels, which is the hormone that actually processes sugar and breaks it down. And if there's too much of it in your blood system, again, the hormones responsible for the glands responsible for producing insulin become exhausted, and insulin doesn't get produced as much, and that actually can cause dopamine synthesis reduction, which would also mean deficiencies. The other problem is if you have trouble with your gut. In other words, you're taking a lot of antacids, and that actually can cause a deficiency in dopamine synthesis, which then causes a deficiency in the hypothalamus, which then would cause a deficiency in the thyroid. So you see, the thyroid system is interrelated. It's not possible to break it down. You can't just separate things. The other thing is hormone replacement. Estrogen replacement therapy can have a deleterious effect on dopamine synthesis. So you have to look at a person as a whole. You can't just give them thyroid hormone or Synthroid or Armorol, whatever, because you don't really know why their TSH is low or high. You have no idea because you need a fuller, complete picture. So it's very important to get a thorough history to fully understand why an individual's thyroid or they have thyroid symptoms. Also, the proper blood work to find out, do they have sugar problems? Do they have neurotransmitter problems? Do they have stomach problems? All this relates and impacts the hypothalamus, paraventricular cells, which actually can impact the thyroid gland. So it's important that you find someone that knows what they're doing in this regard. And don't waste your time.